Hi, my name is Joshua Matthew, and I will be talking about the herpes virus. Now, the herpes virus has many ways of infection. Certain types of infection include active lesions. Carriers for the herpes virus 2 often are spread through genital contact and through close body contact. And cracks and cuts in the skin are perfect and prime examples of ways these carriers and viruses can spread. Herpes virus 1 is mostly found in children through close contact in places such as schools, daycares, as an easy access for these viruses. And herpes virus 2 is between the age brackets, mostly between 15 and 28 years old, and it is mostly due to sexual activity. Now we talked about herpes virus, the 1 and 2 in the diagnosis. First of all, the treatment is it's a chemotherapeutic agent, and basically for the virus, in the healthcare industry, patients come in and out, and you never know what the patient has. So the best way to stop the contact between the doctors and nurses and the patient is for the medical people to wear gloves, and the best way to stop it is through abstinence. In the next slide, I'll be talking about herpes virus 3, and these are two types of diseases. The varicella, which is also known as chickenpox, is mostly found in children, while herpes zoster, also known as shingles, is mostly found in adults. Now the treatment and how they enter. Chickenpox is highly infectious. The CDC states that there are more than 3.5 million cases of varicella. These spread through the skin of the respiratory tract as well as the eyes. The thing is, you don't find the symptoms right away. It takes 2 to 3 weeks for you to figure out and see the signs and symptoms. In children, this can be quite mild. However, in adults, this virus is very severe. The thing about this virus, which makes it tricky, is once it gets in and the symptoms, you treat the symptoms and it goes away, the virus is still there. It can still reactivate at any time, and the rashes can occur under the armpits can occur. This is an example of a child with chickenpox. As you can see, the face, there's dots, spots all over the face and the chest as well. It's usually found in the upper body area of the face, even the arms as well. And let's see, for children, the treatment is at a young age, children are given a chickenpox vaccine, and this helps slow it down or stop the virus. Shingles, however, is much more difficult to treat because the treatment never goes away really. And for this picture, it shows you how exactly the virus moves. Once it enters, it has one goal. Its goal is to go to the spinal nerve. Once it gets to the spinal nerve, it goes to the nerve cell body, and when it's time to be reactivated again, it goes down that's why it's below the armpits. As you can see, it goes down below the armpit area, and that's why the rashes here occur. Let's see what else. As you can see here, the rashes. See, when it goes down the spinal cavity, it goes right down here under the armpits on both sides. And I will be talking about herpes virus 3, and these are basically the shingles and chickenpox. They have treatment, vaccine, and shingles is much harder to cure. I mean, you can take different kinds of antivirals and nerve medication pain, and that will help not cure, but shorten the amount of time the illness occurs. Preventing is kind of difficult because there's no obvious signs. When you first get the disease, infection, you can't tell unless there's rashes. If there's not rashes, you won't know you have the virus. Next, I'll be talking about the herpes virus 4, also known as EBV. There's many ways for it to occur, as you can see from the next slide. Oral hairy leukopenia, which is due to saliva, getting in through the saliva. Burkitt's lymphoma, also a type of cancer. And for this child, however, it's asymptomatic, which means there's no signs. And thing is, all these have in common is the state of cellular immunity. They're all lacking, poor, and normal, but poor and lacking are basically the main ones, because the job of these viruses is to attack the B cell, which is antibody, And if the body does not have antibodies to protect from foreign invaders or antigens, then these viruses can spread. And the reason it spreads is because the B cells are inactive, and the T cells, when the T cells kill the B cells, the antibodies, it stops protecting it, and these viruses, well, it suppresses the T cells, so the T cell is very inactive or not useful. Next I'll be talking, and then also treatment for this would be chemotherapy. For the burkitt's on the neck would be chemotherapy, and prevention is kind of hard because it's really widespread in saliva. You never know when you can be in contact with saliva. Say you're jumping in a lake and someone was spitting or something that's infected with the disease, and you have an open cut or wound and the saliva or parts of it go into the skin, then now you're infected. And next, here's some treatments as well. Chemotherapy is what I mentioned earlier, and prevention is just staying away and being in a sanitary environment. Herpesvirus 5, you can tell right away when the cells are very large. You can tell it's herpesvirus 5. They're the most common. It's a startling fact, but 50% of the adult population in America has this virus, which is startling. And infection, it can occur through bodily secretions, mouth, and any other ways of entry, and close contact. It mostly occurs via sex. And the bad part about this virus is how it can affect infants and fetuses. When a mother gives birth, the baby is most likely to have infections such as retardations and other complications. Now here are the treatment. Ways of finding out how to solve herpesvirus 5. You can take the ELISA test. A little background about the ELISA test. It detects and measures antibodies in your blood and the antibodies to certain infectious conditions. So if you have infection of herpesvirus 5, your blood will be making antibodies against trying to fight herpesvirus 5. And that's how we will know you'll have the disease. Treatment is harder for fetuses because once they're born and they have it, you can't really do anything until you see the signs. So once you have the signs, it's a little bit too late. Prevention, as always, is to be abstinent. And here's the treatments as well. It's harder for fetuses. And here's owl's eye treatment, also known as Reed-Steinberg cell. And these are usually found, as you can hear, the owl eye sort of. And as you can tell, most of these blood cells are people with cancers or lymphoma. Herpesvirus 6, it's also a telltale sign of seeing how you have herpesvirus 6 is if there's signs of roseola. It's a pink rash all throughout the neck and body area. And people that are most likely to have herpesvirus 6 are people with AIDS or more susceptible to having AIDS. And herpesvirus 8, it causes Kaposi's sarcoma. That's another type of cancer. And thinking about it is AIDS patients are most likely to have this sort of herpes virus. As you can see, here's roseola. As you see, the pink rashes all throughout the back, in the butt, and here in the thigh area, and the arms as well. And lastly, here's the Kaposi's sarcoma. Here's you see the black lesions and the cancer cells. And these are mostly found in patients with AIDS. And that would conclude my presentation about